and good evening. My name is Dr. Pamela Frank. I'm a licensed naturopathic doctor here in Toronto, Ontario. I would love to be able to help you understand your hormones and your skin. So let's get right into it. Your skin is the largest and one of the most important organs. It plays a number of roles in maintaining a physical barrier to protect your insides, but your skin also helps to regulate your temperature and act as a route for elimination of fluids like sweat and oil. Your skin is covered in small glands called sebaceous glands. They secrete an oil called sebum that lubricates your skin and keeps it healthy. Within these glands are receptors that respond to your hormones. So what are hormones? Hormones are chemical messengers that are produced in organs such as your ovaries, testes, adrenal glands, and thyroid. When there's too much or too little of a specific hormone being produced, your skin reacts accordingly. We know there's a connection between hormones and the skin because certain hormonal disorders, such as polycystic ovarian syndrome, manifest themselves by affecting your skin and your hair. Now let's explore some specifics. When it comes to hormones, estrogen is probably the most widely known and discussed. While it's true that estrogen is primarily made in your ovaries, it's a hormone that is also found in males and is also made in other tissues such as fat tissue. In the skin, estrogen affects the thickness, wrinkle formation, and moisture levels. Estrogen also increases glycosaminoglycans, such as hyaluronic acid, to maintain fluid balance and structural integrity of your skin. Testosterone is the hormone responsible for coarser hair and thicker, oily skin. This hormone is heavily involved in sebum production. Too much testosterone can cause acne, clogged pores, and other blemishes. Cortisol is a hormone that is produced in your adrenal glands. High levels of cortisol result from being in a state of chronic stress. Too much cortisol can result in acne and thinning skin. Low levels of cortisol can result in changes in skin color and pigmentation. If you're suffering from hormone-related skin issues, your first thought might be to go to the drugstore and grab some skincare products, but that won't solve the root of the issue. While it's important to keep your skin clean and well protected, which we'll discuss later, masks, toners, and serums won't be able to do their best if you don't address the environment inside your body. That means making changes to your diet and lifestyle as well. Yes, today we'll be discussing which lifestyle changes can most heavily influence your hormones, which will be your first step toward creating a plan of action. Each person has a unique body, which means that each person's wellness journey looks a bit different. So be sure to follow up with me after the end of this webinar so that I can create a plan that works just for you. From acne in adolescence to thinner skin during menopause, hormones affect our skin differently throughout our lives. Let's take a look. It's very common to experience acne alongside monthly cycles. It's because your estrogen levels are dropping. This is likely because estrogen helps to stop your glands from overproducing oil, kind of like an anti-sebum. So, without enough of it, the pores become clogged. Sweating more than usual, as well as experiencing dry skin, are also common symptoms that occur during a menstrual cycle. Lastly, if you have any skin conditions like psoriasis or dermatitis, they may also worsen during your menstrual cycle. Acne happens during puberty because new hormones are being introduced into your body. Often, this acne appears in your T-zone, on your forehead, nose, and your chin. These hormone fluctuations may aggravate acne by increasing overall skin inflammation, sebum or oil production in the pores, clogged skin cells and hair follicles, promoting the growth of acne-causing bacteria called Propionibacterium acne. How pregnancy affects your skin. During periods of elevated hormonal activity such as pregnancy, estrogen can cause skin pigmentation, also known as melasma, in certain sun-exposed areas such as your forehead, nose, and your cheeks. When menopause starts, your body experiences a natural decline in reproductive hormones. This can cause your skin to appear flushed, red, and blotchy. Why? Because estrogen has anti-inflammatory properties. So when it's gone, inflammation in your skin and conditions like rosacea can get worse. Losing estrogen can also result in less collagen production, dehydrated skin, and a lighter, more pale complexion. A hormone balancing diet requires a healthy digestive tract, stable blood sugar levels, and a well-functioning liver. Before creating a diet that works for you, it's crucial to gain an understanding of how your body is currently operating, as well as exploring what could be improved. There is no one-size-fits-all diet plan to fix your hormones. Depending on the health of your body overall, you'll be able to determine how drastically you need to change your diet. Eliminating sugar and processed carbs from your diet can help keep levels of certain hormones, like insulin, in check. Additionally, fluctuations in your blood sugar puts stress on your adrenal glands. These glands regulate cortisol, one of your stress hormones. When cortisol levels spike, your skin gets extra inflamed, causing acne, psoriasis, and other skin conditions to get worse. For as long as we've been socialized to believe that fat is something that should be avoided, but now we know that healthy fats are actually essential to keep our bodies feeling happy and healthy. Long-chain omega-3 fatty acids may help to lower cortisol levels, so be sure to include foods like whole eggs, olive oil, avocados, nuts, seeds, coconut oil, and nut butter into your diet. Alcohol can affect your blood sugar levels and cause a spike in estrogen and other hormone levels. One study published in the medical journal Alcohol and Alcoholism found that for women in their 40s and 50s, even just moderate consumption, such as 1 drink a day, can affect their hormonal system. Many women at menopause tell me that they can't have 1 glass of wine in the evening, otherwise they will be up the entire night. Getting excited about physical activity. So physical activity strongly influences our hormonal health because exercise reduces insulin levels. In a 24-week study of obese women, exercise helped to balance insulin as well as levels of adiponectin, a hormone that has anti-inflammatory effects and helps regulate metabolism. Studies have also found that being physically active may boost muscle-maintaining hormones that typically decline with age, such as testosterone and growth hormone. Although a combination of resistance training and aerobic exercise seems to provide the best results, engaging in any physical movement is always beneficial. In order for your body to work at its full capacity, it needs adequate time to rest and recover. Most people aren't getting enough sleep or enough quality sleep, which is messing with their wellness in many ways. To get your sleep schedule in order, prioritize having a regular bedtime and wake-up time. Practice good sleep hygiene by using blue light blocking glasses for screen time at night or swapping out your phone for a book. When our cortisol levels spike, our skin can become inflamed as a response. If you're serious about clearing up your skin and your overall wellness, take proactive steps to manage your stress. Millions of people are discovering the power of mindfulness, which can be practiced in hundreds of ways throughout your day. You could also try meditation, yoga, tai chi, or simple breathwork exercises. There are millions of products out there on the market that claim to fix your skin issues. I encourage you to stop chasing the hype and get back to basics when it comes to treating your skin. Start with simple cleanser morning and night. Apply a non-comedogenic moisturizer, which means it won't clog your pores. Ideally, for me, moisturizers should be something edible, like coconut oil. Anything that you apply to your skin, about 25% of it gets absorbed into your bloodstream. So we don't need to be applying chemicals that might be having unwanted hormonal effects. Thank you so much for joining me today in this special event. I hope you found some of the information that I've shared to be useful. One of my main goals is to instill the importance of listening to your body and personalizing your wellness journey as much as you need to. That being said, I know that I covered a lot of information and there are a lot of lifestyle elements that you may need to examine if you're serious about your health. I'm happy to work with each of you to create a plan that meets your goals and matches your particular body. All you have to do is reach out. If you live anywhere in Ontario, call me at 416-481-0222 or book an in-person or virtual appointment. So anywhere in Ontario, I can offer advice, but I can't offer advice to anyone who's outside of Ontario. Thank you again for joining me, and if you'd like to contact me to book an appointment with your problem skin or your hormone balance, call me at 416-481-0222, or you can email me, which is pfrank, N like Nancy, and D like David, so pfranknd at forcesofnature.ca. Thanks so much and have a wonderful evening.